Welcome to Hotze Elite Physicians Podcast, where you'll learn how to help your patients obtain and maintain health and wellness naturally, and how you can have more time, more money, and more freedom to enjoy your life. And now your host, Dr. Hotze.
You're probably aware that 600,000 people die every year of heart disease, and it's preventable. Hello, I'm Dr. Steve Hotze, and I believe you need a coach, a doctor who's had a successful medical practice to help you build a successful medical practice. Today, we're going to discuss information about heart disease that you can incorporate into your practice that will help you improve the quality of your patient's life and, in fact, save their lives. In 1988, my father came to my office after giving me a call earlier in the morning saying he wanted to visit with me, and he came over, and I said, "What's going on, Dad?" And he said, "Son, I'm having some chest pain here, and I just kind of want you to take a listen to my heart and maybe do an EKG and tell me what you think." So he described the chest pain to me, which was retrosternal. It radiated into his shoulder, and it had been intermittent off and on during the day and over the last several days. And I said, "Well, Dad, sounds to me like you have some angina," which, of course, is poor blood flow through the coronary arteries to the heart, and you're having a problem getting oxygen to the muscle in the heart, and you're having this pain that develops. So I said, "Dad, I tell you what I think we need to do is we need to take you over to Dr. So-and-so, a friend of mine at a local hospital here." And we went back to the cardiologist's office, saw him. He placed him in the hospital overnight. Next day, ran some studies, did an arteriogram, and found that he had a blockage in his left anterior descending artery. Well, and he recommended at this time that the best way we should progress is to do an angioplasty. Now, this is back in 1988, before stents. And so the next day he was scheduled for angioplasty. They took him to the angioplasty lab. I'm in there, and I'm looking at the lab. I'm not 10 yards away from the table. I'm looking through a glass wall. I'm looking at the cardiac monitor. And as they're doing the procedure, I see very irregular development in my father's electrocardiogram. And I knew something had happened, disastrous in nature. So I got on the phone, called up my good friend and cardiovascular surgeon, Dr. Robert Feldman, who was on call. Said, "Bob, get on over here. We need help. They just blew open Dad's LAD." And he came over. My dad underwent bypass surgery. And he survived, but not before he sustained a tremendous amount of damage to his heart. After he was in the hospital for 2 weeks and had been out of the hospital really for 2 weeks, one Saturday morning, he gave me a phone call. He said, "Son, I want to talk to you. Come over here." And he wasn't in a good mood. I got over to this house, and he goes, "Dad," he goes, "Son, let me just tell you, I don't know what in the heck I was thinking, letting these doctors invade my body." Now, my dad was an engineer, and he said, "This violated every engineering principle conceivable. I let them go into my body, and I've got calcified arteries, and they're going to take a balloon, and they're going to balloon it up and try to squash up against the wall." Well, inevitably, what's going to happen, just like it happens in the pipelines that we service, and my dad was in the oil and pipeline business, you put pressure on it, it's going to blow, and that's what they did. So he hands me an article by Dr. Julian Whitaker, who's a doctor who does natural approaches to health, who's headquartered out in Newport Beach, California. I've been to his office since this time, and he's been to my office, so I've become good friends with him over the years. But at this time, I didn't know about Dr. Whitaker, and I read his article, and it talked about heart disease and heart attacks. And he gave some statistics at that time that if you had angioplasty after a heart attack within the first year, you had a 15% mortality rate. If you had bypass surgery, it was 5%. If you did nothing but exercise, lose weight, eat healthy, take your vitamins and minerals and nutrients, and keep your blood pressure under control, you had a 1% chance of dying. And his recommendation is don't let the doctors invade your body. Dad said, "What do you think about this?" And I said, "Dad, I wish we'd have tried it. I'm sorry." And he said, "Well, this doctor says I need to take vitamins. What do I need to take?" And I looked at him like a deer in headlights. Well, Dad, Now, I'd graduated from med school in 76, mind you, UT, University of Texas in Houston. Now, here I am 12 years later, and he goes, son, what vitamins should I take? And I just stood there dumbfounded. And then I said, Dad, I'm a doctor. What do I know about vitamins? And my dad was a very successful entrepreneur. He's the father of 8 kids, 7 boys. I was the oldest. He looked at me and said, son, will you find out? I said, yes, sir, I will. And I did, and I have. So I began to look at alternative approaches to heart disease way back in 1988, before I'd even set up the Hotze Health and Wellness Center, which didn't even begin in its infancy until 1989. So now, fast forward about 29 years, and here we are, and I'm talking about what you can do for your patients to help them prevent developing coronary artery disease and coronary or just vascular disease of any kind. So let's talk about heart attacks. Let's talk about heart disease and the underlying causes of heart attacks. Heart attacks are caused when there's a blockage in one of the main coronary arteries that prevents the blood from properly flowing into the muscle of the cells of the heart muscle. So, of course, a heart attack is caused by a blockage in the coronary artery, which adversely impacts blood flow to the heart muscle cells, leading to death of those muscle cells, which can lead to cardiac arrhythmias and sudden cardiac death. In worst case scenario, and remember, the first time a person has a heart attack, half the people that have a heart attack for the first time die. So if they don't die, it causes heart damage. It's going to lead to severe heart problems. So what caused the coronary arteries to block? Was it elevated cholesterol? Is cholesterol the cause of heart disease? If you ask the average layman on the street, if you ask them what's the cause of heart disease, most of them will say elevated cholesterol. If you ask most physicians what is the cause of heart disease or what is the cause of heart attacks, most people will say, well, one of the causes, or if not the main cause, is elevated cholesterol. And I want you to understand that is totally erroneous. Heart attacks are caused when the coronary arteries become blocked. Now, how does that happen? First, coronary artery disease is caused when there's inflammation in the coronary arteries caused by toxins that adversely affect the lining, the intima of the coronary artery. And those toxins would be, first and foremost, petrochemical products that we breathe in the air, drink, eat, slather on our bodies. Could be the metals that we have. Could be heavy metal toxicity that causes the inflammation in the arteries, from lead or mercury from fillings in our teeth. Could be from aluminum. It can be caused by recurrent and chronic infection, particularly people with gum disease and abscesses in their teeth can have problems with coronary artery inflammation. It can also be caused by any other type of infections, Helicobacter pylori and some chlamydial infections and other infections of any type can cause inflammation in the coronary arteries. On top of this, a diet that consumes a lot of sugar and a lot of simple carbohydrates, which are converted to sugar, have pro-inflammatory responses and can cause inflammation in the coronary arteries. So all these things cause inflammation in the arteries. Now, the body's primary mechanism for healing the coronary arteries would be to lay down collagen, to line the inner lining of the arteries when there's some inflammation. The body wants to heal it. So the primary mechanism is to lay down collagen, which is the protein glue that holds all the cells together. Well, to make collagen, you've got to have copious amounts of vitamin C. Vitamin C, it plays an integral role in the production of collagen, as does L-lysine and L-proline, 2 amino acids. If an individual doesn't have adequate amounts of vitamin C, particularly in the area of the heart, and mind you, when the artery gets inflammation, as the heart beats every time, it's stretching and it's compressing those coronary arteries. And if they're inflamed, they begin to deteriorate. So if the primary mechanism doesn't work, and remember, human beings, unlike most mammals and other vertebrae, don't make vitamin C. The only mammals that don't make vitamin C are human beings, monkeys, guinea pigs, and a few bats somewhere in Brazil. So We don't make vitamin C, but all the other mammals and vertebrates do. And as a matter of fact, most mammals make vitamin C to the tune of about 100 milligrams per 25 pounds of body weight. You might be interested to know that dogs and cats and horses and giraffes and elephants don't get heart attacks. They don't get coronary artery disease, nor do polar bears. They've done studies and they find no inflammation in the coronary arteries. Why? Because they make vitamin C. Vitamin C is important in the production of collagen. And so if there's any inflammation, the collagen simply heals it, and they heal over just as you would if you happen to fall and scrape your elbow and skin it up. It's going to heal over very nicely. But if the body doesn't have adequate amounts of vitamin C, guess what? There's a backup mechanism. The body takes lipoprotein A, which is a type of low-density lipoprotein, and it begins to patch the inflamed wall because the body doesn't want that artery to break down and completely deteriorate and fall apart. That'll lead to death. So as the plaque gets laid down, there's some inflammatory response to that. So certain inflammatory cells come and invade the plaque, cause it to grow. The plaque also begins to absorb and assimilate calcium that floats in the blood and begins to harden. So you get calcification of the coronary arteries to one degree or another. It starts off small when you have inflammation, and then the more inflammation you have and the longer that you have it, inevitably you're going to end up having significant and severe atherosclerosis. Atherosclerosis comes from the Greek word athero, which means porridge. Think of the plaque on the wall. And sclerosis means hardened. So it's hardened porridge. That's what they found when they did studies of individuals after they had died, and they did autopsies in the Greek days. They found hardened porridge in the walls of these arteries. In other words, they had atherosclerosis. And atherosclerosis, if you think about it, is a wonderful mechanism to regain stability in the coronary artery wall. Initially, it performs a great function. It provides the rigidity so the artery doesn't break down. But as inflammation continues and more plaque builds up and more calcium is absorbed, what have you got? Then you got a narrowed coronary artery, and if a plaque breaks off or a clot floats down there and it blocks the passageway, then you've got impingement of blood flow to the heart muscle cells. And what have you got? You get a heart attack. So that's not a good thing to have happen. It was not caused by the cholesterol, the low-density lipoprotein. It was caused by the inflammation. So if you want to prevent heart disease, you don't lower the cholesterol using statin drugs, which can cause, you can go and look up the dangers of statin drugs and know how it poisons the enzyme system in the liver, which is necessary to make cholesterol. It also poisons the enzyme system for the production of coenzyme Q10, which is a critical energy-producing molecule within the cell, particularly the heart cells. So when a person develops coronary artery disease, that can lead, and it dramatically increase the risk of a heart attack. So how can this be prevented? Well, first thing, it's got to be identified. We do on all our guests here at the Hotze Health and Wellness Center, I have a heart scan, and we do a CT heart scan on all our guests, and we get a calcification score to find out how much calcium, if any, they have in their coronary arteries. And obviously, as a person ages, the odds of him or her having developed calcification of the coronary arteries increases. So we find this in our guests. So we have anywhere, I've seen people with just calcium score of 2, which is nothing, basically. It's minimal. I've seen individuals with the scores in the 3,000 and 4,000s, which is very, very severe, and you have everything in between. But by getting a heart scan, you can determine the status of atherosclerosis in the individual's heart, and then you can work at addressing how do we stop and how do we reverse the problem? How do we clean up the arteries? And so there's a program that we use to help individuals who have coronary artery disease, which is asymptomatic. And remember, the first heart attack is usually asymptomatic. Person develops a heart attack, and half the time they're gone. They don't ever live to tell about it again. So half the people that die, the first time they knew they had a heart problem was when they had a heart attack. So it's much better to determine whether or not a person has coronary artery disease non-invasively. And the best way to do that is to do a CT heart scan. Now, you can do stress EKGs, you can do nuclear EKGs, you can do echocardiograms. We've done all those. We don't do them here at our center. But we do the heart scan here, and it's a great non-invasive method that helps us determine the level of an individual's calcium, if any, that they have in the coronary arteries. Then we can begin to devise a program that will help them. And what we find is individuals, if they find out they have calcium in their arteries, wow, that makes a big difference in whether or not they're going to be compliant. I'll assure you the patients that have coronary artery disease as demonstrated on the heart scan with elevated calcium scores, I can assure you they're much more compliant on the program than people that don't, because they don't want that to develop into a heart attack, and we're giving them a chance to intervene so we can arrest the coronary calcification and reverse it. And we do that using a multifaceted program. Now, here at the Hotze Health and Wellness Center, first thing we start with is a good, healthy eating lifestyle. The first and most important thing an individual can do to cut down on inflammation in their arteries, first and foremost, is change their eating lifestyle, where they eliminate sugar and they eliminate all simple carbohydrates, which are simply sugar molecules, starches, sugar molecules hooked together. Those have pro-inflammatory effects, and you've got to get rid of those. Get those out of the eating program. That will help them get, well, here's what happens. You've seen it in your practice, I know. The patient comes in. They're overweight. They're on a high simple carbohydrate diet. And what's caused this to happen? Well, now they've gained weight, 50 or 100 pounds. They're overweight. 35% of your guests are overweight. 35% of the are obese. 35% of the population is obese. 70% of the population, including the obese, are overweight. We got 7 out of every 10 people you see are overweight or obese. What does that lead to? Well, you know what it leads to. It leads to pre-diabetic syndrome and diabetes, adult onset diabetes, type 2 diabetes. It leads to high blood pressure problems. It increases the risk of coronary artery disease, kidney disorders, degenerative arthritis. It can lead to Alzheimer's problems, strokes. A host of health problems can develop and increase incidence of cancer. So we know that being overweight is not healthy. And so what we want to do is we want to change the eating lifestyle of our guests so they eat either a paleo eating program. First, we start them on a yeast-free eating program. They have no yeast in their diet at all, so that would cut out all alcoholic beverages, cut anything that causes yeast to grow, and that would be all sugar and simple carbohydrates and any fruits. So we put that on a strict eating program for a month. Then we can graduate them to a paleo eating program or to a ketogenic eating program, where they focus on most of their calories come from good, healthy oils and fats, eggs, butter, fish oil, olives, avocados, guacamole. They eat then a modicum amount. That's about 70% of their intake. Then they eat the balance of their intakes, 15% good, healthy vegetables, low-carb vegetables, spinach, broccoli, asparagus, Brussels sprouts. And then they eat a modicum amount of meat, maybe 4 ounces of meat a day. And they eat this way, and this helps them lose weight. It helps, as you know, individuals, as they're on a simple carbohydrate diet, they get pre-diabetic syndrome and adult onset diabetes. What do they get? Insulin resistance. So by taking the sugar load off, what you're doing is you're enabling the receptors in the cells now to be more responsive to insulin. You're also cutting down on the insulin production in the pancreas. And what does that do? That helps prevent the sugar from being converted to fat. And you know as well as I do, anybody that you put on insulin who's adult onset diabetes is going to gain weight, because that insulin is going to drive that sugar into the fat, into adipose tissue, especially when they have insulin resistance, where they're going to have, if they're already a diabetic, adult onset diabetic, they got elevated sugar, they got elevated insulin, and now you're going to give them more insulin, which is simply going to drive that sugar into the fat, and you're going to just compound the problem. So I've seen this, and you've seen it over and over again. So you've got to break the cycle there. You've got to get the individual on a good, healthy eating program. Then The second thing you want to do with someone who has got coronary artery disease is get them on a good vitamin and mineral program. Good B-complex vitamin, strong B-complex vitamin. We use Energy Formula here at our center, which is a proprietary blend that I have with some key B-complex vitamins as well as some minerals that are very important. We also use high dose of vitamin C. I'm a strong advocate of vitamin C. I've read numerous books and articles on vitamin C. I started by listening to Linus Pauling and reading Matthias Rath's book, Dr. Matthias Rath, Why Animals Don't Get Heart Disease or Heart Attacks. That's well worth reading. Well documented. And the reason they don't is they make vitamin C. And that allows them to make plenty of collagen that keeps their coronary arteries from being inflamed and heals the inflammation. I recommend minimally 1,000 milligrams per 25 pounds of body weight. Since 1990 or 91, when I first listened to Dr. Pauling and I listened to his the broadcasts that he had, read his books, and I said, you know what, this makes sense to me. That makes sense is a cause of coronary artery disease and the other benefits of vitamin C. I said, I'm going to start taking it. I started taking 10,000 milligrams a day. I have increased that over the years. I currently take about 20,000 milligrams a day. I have no problem with bowel intolerance. I do fine. We use just a regular form of ascorbic acid or ascorbate. A newer form that's come out that even gives better long-term blood levels is liposomal vitamin C, and you can look into that. And we're going to be offering that here at the Hotze Vitamin Store in no short order. But that's something that is new that really gives you as good or better levels than if you get IV vitamin C, which, by the way, we do use with our guests because vitamin C has it in high doses has antiviral, antibacterial effect. It has antitoxic effect. It's a remarkable vitamin in the proper doses. Now, you may have read studies that say, well, they did a study of vitamin C and it didn't really help the problems at all. It's because it's dose related. They have to have high doses of vitamin C to get resolution of an acute problem. And so in PubMed, if you just go Google PubMed, you're going to see, I don't know, they've got some incredible number. I can't remember the number. I want to say it's something like 55,000 articles on vitamin C in medical journals around the world. Vitamin C, if you did not take vitamin C if you took it out of your diet altogether and you got no vitamin C, within about 1 month, you would be demonstrating some of the signs of scurvy. Within 3 to 6 months, you'd be severely sick. Your tissue would be like paper. You would bruise easily. You would get gum disease. It would proliferate. Your teeth would get rotten. You'd begin to have mental disorders. You'd get swelling in your joints. And then if you're off of it have no vitamin C in your diet for 6 months to a year, you're dead. You die of scurvy. And I've seen in hospitals individuals who get no vitamin C at all, and I've seen their skin, and you've seen them too in the hospital. Remember in training, it was all bruised and all over the body, not just where they did the IVs, but bruised all over the body, on their hands, everywhere. These people had scurvy, and they don't get enough vitamin C. Now, in the RDA from the United States Health Department, they have certain value for vitamin C. It's some low dose, I don't know, 80 or 90 or 100 milligrams. I can't remember what it is. It's some ridiculously deficient amount, which will only prevent you from getting scurvy, but it won't give you vibrant health. Vitamin C has wonderful properties, and I want to be sure to mention that. I'm going to have some podcasts on vitamin C and its benefits in the coming weeks. So we get our patients good healthy eating program, vitamin program, which includes vitamin C, magnesium, L-lysine, L-proline, and we use on magnesium. Remember, magnesium regulates heart rhythm. It also relaxes smooth muscles in the arteries, so it lowers blood pressure. And the most common cause of low blood pressure, doctors, is low magnesium levels, hypomagnesemia. And so the way you can treat it, you can't hurt anybody with magnesium. I put all our guests, if they have high blood pressure particularly, we always put our guests on at least 600 to 800 milligrams of magnesium citrate or magnesium glycinate. Glycinate's a little easier on the bowels. Magnesium, as you know, promotes good bowel function. Remember, they used to sell back in the old days magnesium, Milk of magnesia. That's it. Milk of magnesia. That's what they sold, and all the old folks drank it every day. Magnesium does have a good effect on promoting healthy bowel function. Take a lot of it, you're going to have loose stools, really. So magnesium is important. It lowers blood pressure, and I can't tell you the number of people that I've gotten off their blood pressure medication just by getting them on magnesium and getting them on a good eating program. Also, L-lysine and L-proline are important for the formation of collagen. So you need L-lysine and L-proline. K2 will also help you remove calcium from the arteries. So does vitamin C. Coenzyme Q10 is very important for heart function. It helps the heart muscles generate energy within the mitochondria, the power plants of the cell. And so does vitamin C. Vitamin C is very important for that, as is magnesium. So we want to make sure they get on a good vitamin and mineral program. And if you do this, get on a good healthy eating program. And by the way, Dr. Dean Ornish, who wrote Reversing Heart Disease, proved decades ago that simply by putting his patients on a strict vegetarian program, he could eliminate coronary artery disease and dramatically decrease the symptoms that were associated with coronary artery disease. So this isn't some, wild thought that I've dreamed up. This is well established in medicine and has been for 20 to 30 years. But unfortunately, when we were in medical school, they failed to teach us about the importance of nutrition and what kind of eating programs are important to keep people healthy. And they didn't teach us. I can't remember taking a course on vitamins in med school. If I did, it went over my head, but it couldn't have been much more than an hour. But we never talked about vitamins except in deficiency states, and that was just rarely, if that was ever even discussed in medical school. So this is something you have to learn on your own. Now, the third thing that's important is thyroid hormone. Hypothyroidism leads to the development of mucin. It's called myxedema. That's where the word mix comes from. And the mucin that forms when people have hypothyroidism forms in all the cells of the body. It can form in the cells of the coronary arteries. When you remember, the thyroid hormone enables your cells to produce and use energy for all the cells of the body. And so if you don't produce enough energy in your cells are going to run sluggish. Your organs are going to run sluggish. You're going to run sluggish. Your patients will run sluggish. So what you want to do is and that adversely affects your immune system. So if you have an unhealthy immune system, you're going to be recurrently and chronically sick. That's what you see in patients in family medicine and internal medicine. You have patients that have recurrent and chronic infections. That has an adverse effect on creating an inflammatory situation that can damage the coronary arteries and cause inflammation. So you want to have the immune system healthy, and to do that, you have to have good energy production, and the thyroid hormone helps do that. So we supplement when indicated. When an individual has the signs and symptoms of hypothyroidism, we supplement them with a therapeutic trial of natural desiccated thyroid. Desiccated, not synthetic, not Synthroid, not Levothyroid, not Levoxyl, but Armour-thyroid or compounded thyroid, desiccated thyroid hormones. So we start on minimal doses and we gradually increase to see if the symptoms are resolved. If it does, that indicates that our diagnosis was true about hypothyroidism. So when an individual has the signs and symptoms of hypothyroidism, I don't care what the blood tests say. Your blood test, you can't treat a blood test. Patients have clinical symptoms. The blood tests, as you're well aware, have a mean and 2 standard deviations from the mean, so that 95% of the people always fall within the range. 95% of the people don't feel normal. If you look around our country, the vast majority of people look profoundly hypothyroid, and there's reasons for that. So we give a therapeutic trial of thyroid. We replenish the sex hormones when indicated. You see this commonly in women as they march through midlife. Men, by the time they hit 40, their testosterone levels have declined, so we replenish both in males and females their sex hormones using natural bioidentical hormones. Also, we encourage a good exercise program for our guests so they get some aerobics. Now, that doesn't mean they have to run a marathon. For crying out loud, if you can just get them out walking a mile or two every day, briskly, that would be good. They may want to swim. They may want to bicycle. They may have a treadmill at their home. What you can do, whatever you can do to get your patients to get about and start moving. Now, additionally, there's some simple things that the patients need to do. One is eliminate smoking. We know that nicotine and the products and the tars that come from the smoke have a terrible inflammatory effect upon the coronary arteries and leads to coronary artery disease. Excessive alcohol intake can have an adverse effect on the heart. And interestingly enough, pharmaceutical drugs, prescription drugs, can also have an adverse effect on the heart. You know, the nonsteroidal anti-inflammatory drugs all have as one of their side effects the creation of coronary artery disease. So here's a patient with arthritis. Instead of getting at the root cause of the arthritis, you just give them an SID, and the next thing you know, about 2 or 3 years later, they have a heart attack and die. But then you console the family by saying, well, at least he didn't have any joint pain anymore. They showed this in the Vioxx cases. Vioxx, of course, was one of the first and most prominent NSAIDs. And that was shown that the drug companies knew, even before they brought it to the market, that it caused significant coronary artery disease and increase of heart attacks. And they brought it to the market anyway. Finally, through lawsuits that were brought against the company and all the discovery was done, it found out that Merck, had known this all along, and they didn't really care because they're glad to pay for settlements of a few suits and seal the judgment so nobody knows what's going on. But that was broken by a very famous attorney in Houston by the name of Mark Lanier, who did a wonderful job and beat Vioxx, and eventually it was removed from the market. But don't let that lull you into complacency. The other anti-inflammatory drugs that contain the nonsteroidal anti-inflammatories, such as ibuprofen, all have as a side effect the development of coronary artery disease. What about statin drugs? Statin drugs poison the liver enzyme that allows the body to make coenzyme Q10, which is critical for energy production within the cells, particularly within the heart. So you want to poison your body, take a statin drug. You're poisoning your ability to make cholesterol, which your body needs to make all the cell membranes, which your body needs to make vitamin D, which your body needs to make all the natural hormones in your body. Now, here's what you can do for your patients to help them prevent heart disease. Let's just review these. One, a healthy eating lifestyle. They learn to eat to live rather than live to eat. Second thing, get them on a good vitamin and mineral program. This not only helps heal up the coronary arteries, but it also decreases the toxicities that are built up from the various chemicals in the environment and the metals and the other inflammatory products from our diet, as well as from infections that we have. Be sure to replenish the bioidentical sex hormones, testosterone in males, progesterone, and when indicated, estrogen in females. Be sure to look at their thyroid status from a clinical point of view. Do they have the signs and symptoms of hypothyroidism? Would they benefit from a therapeutic trial of thyroid? It's a whole lot more physiological to give an individual a therapeutic trial of thyroid, desiccated thyroid, than it is to give them antidepressants, anti-anxiety medication, and anti-inflammatory medication, a whole host of drugs. Reduce stress. Stress can cause, obviously, can put people in a fight or flight stress, and they get high levels of adrenaline and noradrenaline, and this can have an adverse effect upon the heart. Eliminate smoking. And make sure you get a good exercise program involved in your patients' lives. And finally, you want to encourage them not only to exercise well, but to avoid pharmaceutical drugs like a plague. Remember, every pharmaceutical drug is a toxin. They all have to be detoxified by the liver, and they're going to adversely affect the mitochondria within your cells so they don't produce adequate amounts of energy, and they're going to be associated with a host of serious and deleterious side effects. You can get your patients healthy and well naturally without the use of pharmaceutical drugs if you can convince them to do a 180 and take charge of their health. When you help your patients understand how they can take control of their heart health by adopting the principles and points I've laid down, they're going to have a tremendous amount of encouragement and confidence in you. What's that going to do? Their lives are going to improve dramatically. And they're going to tell other people about you, so your referrals will increase. And when that happens, you're going to have more time, and you're going to have more money, and you're going to have more freedom to enjoy your life.
If you're ready to do a 180 and take charge of your practice and your life, make sure to visit HotzeElite.com for all the tools and resources you need to transition into a cash-based practice. More time, more money, and more freedom to enjoy your life is waiting for you at HotzeElite.com.
This podcast is solely for educational purposes.